All right. Welcome, everybody. Good afternoon. This session is being recorded, as somebody mentioned. My name is Joseph Moore. I am a staff organizer at Vermont-NEA. I'm joined by my colleague here, Mark Hage. Folks are still coming in, so I'm going to be admitting people. Before we get started, just a couple of housekeeping items. Please make sure that you are muting your microphone when not speaking. We are going to be saving ample time at the end for question and answer, so please hold your questions until the end. Mark is going to be covering our union negotiated healthcare benefits, but I just want to mention briefly before we get started that your union bargaining team is currently in negotiations with representatives of the Vermont School Boards Association for the successor statewide healthcare agreement, which will go into effect in January of 2023. And I just want to remind folks that Vermont-NEA is regularly sending out updates on bargaining, and those updates have been going out in the @Vermont-NEA newsletter, but we are also posting them to our statewide healthcare bargaining website, the URL of which I just posted in the chat, and it's vthealthbargainingteam.org. And that website is really a repository for a lot of useful information and resources, not just on the bargaining process, but also educational materials and information on health benefits in general. And so once again, this webinar is being recorded, and we are going to be posting the recording to that website, vthealthbargainingteam.org. And so as we enter the summer months, we just ask that you please stay up to date on the progress of healthcare bargaining. As you know, collective bargaining is really a collective effort, and it's really important that members are staying informed and engaged in the process. And so, continuously check the bargainingteam.org website, check your email, read @Vermont-NEA, the newsletter, we also have in some of our locals healthcare liaisons who will be disseminating that information. And so with that, I'm going to hand it over to my colleague, Mark Hage.
Yo, thank you and welcome everyone. I'm glad you could be with us today. For the purposes of our gathering, I've taken two distinct presentations and I have combined them. The first half of this presentation roughly will focus on your VHI, Vermont Education Health Initiative benefit plans, their medical benefits, their pharmaceutical benefits, their medical networks, and by that I mean from whom you can get care and where, and then their cost sharing arrangements. The second half of the presentation is going to focus on the terms of the first statewide bargaining experience that came to a close in December of 2019, and its terms went into effect, or most of them did, on January 1 of 2021, this year. And those terms will be in effect through the balance of this year and all of calendar year 2022. So when I talk about those bargaining terms and how they intersect with your VHI plans and your decisions about which plans to enroll in for yourself and your dependents, I'm talking about terms that, again, will be in effect through calendar year 2022. As Joe said, statewide bargaining is going on, the second round right now. And should there be changes as a result of that process, those changes will go into effect on January 1 of 2023. Now, I'm going to be covering a lot of material in a very compressed time period. Some of it's complex and not easy to deal with in a virtual setting. So please, you should feel free to reach out to me at any time, individually or collectively, to address the concerns that you have or the questions that we may not be able to get to today or answer fully. Once we can get back together in person, I am delighted to travel to your school district to address your local union leadership, your regional bargaining councils, your membership as a whole, and deal with any or all of these issues in person. So please don't hesitate to ask for help if you need to. So just before we get started, so that we're all on the same page, if you don't know what VHI is, and there's a lot of V's in our life, as all Vermonters can attest to, VI, as I said, is the Vermont Education Health Initiative. It's a healthcare risk pool. It designs and manages healthcare benefit plans. School districts purchase those plans from us and offer them to you and your dependents. VI has been in existence since the mid-1990s. It is managed jointly by the Vermont School Board's Insurance Trust, VSBIT, and Vermont-NEA. And we're the largest public sector healthcare trust or pool in the state. Okay, so let's get started. Let's assume that this is a kind of introduction to the open enrollment process that takes place every year for most school districts in the mid to late fall. You're asked by your central office, if you're enrolled in a VHI plan now, do you want to continue to be enrolled for the next calendar year? And if you don't want to be enrolled, well, then tell us. If you want to make a change in plans from what you have now, effective January 1 of 2022, tell us that as well. So let's assume I'm introducing you to all of this information to help you make an informed decision at open enrollment time for the kinds of central office administrative project that goes on effective January 1 of 2022. So with that in mind, the VHI plans in 2022, they're not going to change. You're going to have access to the same 4 plans. There's no change in those benefit plans. And you can stay in those plans if that is where you can stay in any plan you're in now if that's where you're happy. And you don't need to sign up again for the plan you're in unless your central office, for its own administrative purposes, asks you to do so. Excuse me for a moment. I am going to turn off my video camera, which will allow me to focus more on the slides and also ensure a higher audio quality, I hope, for you. So you've got VHI coverage now. You do not have to change plans in 2022. 4 VHI benefit plans: Platinum non-CDHP, Gold non-CDHP, Gold CDHP, and Silver CDHP. CDHP translates as Consumer Directed Health Plan. And what that means essentially is that these particular plans that have CDHP after the name can be paired with a health savings account, an HSA, as well as a health reimbursement arrangement. And I'll talk in more detail about those later in the program. All VHI plans offer the same medical and pharmaceutical benefits. Where they differ is in what you pay for those benefits and pharmaceuticals. They also offer you access to the same medical networks, the doctors, the clinics, the other medical providers, and the hospitals where you would expect to get care. Those networks are the same regardless of the plan you're in, along with the benefits. So when you're trying to decide between plans, you're not making a decision based on medical benefits, pharmaceutical benefits, or medical networks. What will be critical in that decision is the cost sharing arrangements in each of those plans. Also, all of the plans, thanks to the Affordable Care Act, which became law in 2010, offer comprehensive preventive care at no cost to you. That includes annual exams for all family members, well baby, well child office visits, immunizations, colorectal screening. There's also a range of services for members who identify as female, annual OBGYN exam and Pap test, screening mammogram, generic oral birth control, etc. And you can find a complete list of those services at the link that I've provided here. And we will be providing access to this PowerPoint presentation on the Vermont-NEA website in the very near future. And we'll let you know when it's posted. Also, for the Gold CDHP and the Silver CDHP, Consumer Directed Health Plan options, there are an extensive array of wellness prescriptions. These are medications that are used to cover chronic conditions or particular medical conditions: asthma, diabetes, hyperlipidemia, hypertension, osteoporosis, and also for prenatal needs. These wellness medications in the Gold CDHP and the Silver CDHP are covered 100% by your insurance plan. They are not subject to a copay. they're not subject to a deductible of any kind. And once again, you can find these wellness medications at the link that you see here. These wellness medications are subject to a copay or co-insurance charge in the platinum and gold non-CDHPs. The exception there being diabetic medications, they too come at no cost sharing in the platinum and gold non-CDHP. Here you have the monthly premium rates for the VHI plans, all 4 of them for fiscal year 2022. You can find these rates on the VHI website. And again, we will post these with this PowerPoint presentation for your use on the Vermont-NEA website shortly. So a moment ago, I said that when you're choosing among the VHI plans, the 4 plans, you're going to know as you make this decision, either to move or to stay in the plan you're in now, that these plans have the same medical and pharmaceutical benefits, and they offer you access to the same Blue Cross Blue Shield medical networks, both within Vermont, nationally, and internationally. So the crux of your decision as to which plan you'll enroll in comes down to a question of how cost sharing is arranged in the 4 plans. And to make an informed decision in this regard, you need to have certain definitions under your belt. When we talk about cost sharing, there are 2 domains of cost sharing, broadly speaking. The first, of course, which I've not referenced here, is your premium payment. That's the total cost of your health insurance plan. And under the terms of statewide bargaining, you have a percentage to pay toward that premium. And you pay that percentage contribution regardless of whether you go to the doctor or not. Roughly 10% of VHI members do not go to the doctor in any given year. They don't file a medical claim, but they still are obligated to make a contribution toward premium, even though medically they didn't see a doctor or any other provider or fill a prescription. The second domain of cost sharing relates to your out-of-pocket costs. And these are costs you pay when you get medical care. If you don't get the care, you don't pay the out-of-pocket share. And these out-of-pocket amounts break down into 3 categories: copayment, deductible, and co-insurance. Now you'll notice on the screen, I've got the pronoun you in quotation marks. And this is because when I say you, I don't mean you, the employee alone. You can be you, the employee, or your dependent, but it can also be your employer who's contributing, or it can be a combination of you and your employer contributing, depending on the plan you're in and the negotiated cost sharing terms. A copayment, simply put, is a fixed dollar amount that you pay at the time of service for a specific service. For example, might be a $25 copay for an office visit. It might be a $15 charge for a generic medication. Fixed dollar amount linked to a particular service at a particular time. Again, depending on the plan you're in, the amounts may vary. Now, a deductible is the amount you pay toward the cost of specific services over a calendar year before, in this case, VHI makes a payment toward your medical care. And deductibles, understandably and probably, again, well known to all of us, are generally significantly higher than copayments. And then there's something called co-insurance. Co-insurance is a sort of fancy term, jargonistic term for a sharing of costs between you and, in this case, VHI, or more generally between someone who is enrolled in a health insurance plan and the insurance carrier or the risk pool. So co-insurance is the percent you pay after your deductible is met. And there's a cost sharing formula with co-insurance. For any service that's subject to a deductible, once that deductible is met and you enter the realm of co-insurance, VHI is going to pay 80% of that co-insurance charge, and you're going to pay 20% of the charge. And all of the above, copayment, deductible, co-insurance, when you take them together and you add them up, you reach what is called an out-of-pocket maximum. Each of these plans, all 4 of them, have out-of-pocket maximum financial liabilities per calendar year. And you get to that out-of-pocket maximum, if you go to the doctor enough, by virtue of the combination of what you contribute in co-payments, deductibles, and co-insurance. Here is a graphic representation of what I just said. You see that out-of-pocket maximum foundation and the co-payments, deductibles, and the co-insurance, they all feed into that. And once that out-of-pocket maximum is reached, if it is reached, then VHI is going to pay 100% of your costs going forward until you reach the end of that calendar year. And then your deductibles, your co-payments, your co-insurance obligations, your out-of-pocket maximum obligations, they all reset every calendar year on January 1. Okay, so this gets a little difficult to talk about and follow virtually, but here you have the first two of the 4 plans I spoke to in my opening slides. The VHI Platinum non-CDHP and the VHI Gold non-CDHP. You'll notice that they have different deductible and out-of-pocket maximums. They are subject to, they impose, if you will, or they have co-payments for particular services. They have deductibles and co-insurance for other services. I've highlighted the total out-of-pocket exposure, medical and RX, because I think this is a good way virtually to talk about these two plans without, I hope, getting too lost in the weeds. So you'll notice with the VHI Platinum and the VHI Gold, both non-CDHP options, both of which can only be used with a health reimbursement arrangement. You have a total out-of-pocket exposure, medical and RX, of $2,800 or $5,600 for Platinum and $3,100 or $6,200 for VHI Gold, single and dependency coverage. All of those out-of-pocket costs that you see, whether they're structured as a co-payment or a deductible and co-insurance, as I said a moment ago, they all feed into those out-of-pocket maximums. And once those out-of-pocket maximums are hit, by virtue, again, of you paying a deductible, a co-payment, or co-insurance, or any combination of the above, then VHI will pay 100% of your costs going forward through the balance of that particular calendar year. And then these charges reset on January 1st. Here you see the same breakdown for the VHI Gold CDHP and the VHI Silver CDHP, consumer-directed health plans. You will notice they too have a total out-of-pocket exposure, medical and RX combined, of $2,500 or $5,000 for dependency coverage in the Gold CDHP and $4,000 or $8,000 in the Silver CDHP. Now, in a few ways, these two plans, which are the most popular membership-wise, more than 90% of school employees are in these plans, and overwhelmingly, our members are enrolled in the Gold CDHP for reasons that will be clearer to you in the second half of the presentation. These two plans are fundamentally different from the Platinum and Gold for a few reasons, not the least of which is that virtually every service and medication is subject to a deductible and then co-insurance. The only service that comes with a co-payment is your vision exam, which unfortunately, because of the size of this slide, you can't see. That vision exam, I believe, is a co-payment of $25, but everything else here is subject to a deductible and then a 20% co-insurance charge up to your maximum out-of-pocket exposure, with the exception of your preventive PCP visits, which I talked about earlier, and also your wellness medications for these two plans would also not be subject to any cost sharing. But the lion's share of those services are subject to a deductible and to co-insurance up to these out-of-pocket exposure maximums. With high deductible health plans, and in fact, even without high deductible health plans that we were talking about those, you can pair them with what are called health spending accounts. And these are IRS approved vehicles, if you will, arrangements to help employers and employees pay for out-of-pocket costs. Now, those are some pretty big numbers that you saw a moment ago in these particular plans. And in the high deductible health plan world, Plans can be paired with a health reimbursement arrangement, an HRA, a health savings account, an HSA, or a medical or limited purpose flexible spending account, an FSA. All of them have rules and regulations governing them that the IRS has laid down. And there are complications and issues with each that you need to be aware of if you're selecting a VHI plan, or if you're choosing to move from one plan to another. And in the course of moving, choose a different health spending account. So for example, moving from an HRA to an HSA, or moving from an HSA to an HRA. And I'll talk about some of those differences momentarily. Basically, high level, an HSA, a health savings account, has to be paired under law, under regulation, with a consumer-directed health plan. You'll notice the platinum and gold non-CDHPs, which I talked about already, you can't pair those with an HSA. You can pair them with an HRA. And that's because those two options of the four are not deemed to be consumer-directed health plan consistent with IRS regulations. An HSA can be funded by an employer or an employee or both. However, the IRS rules prohibit contributions by employees or employers in some cases, and they restrict the use of HSA funds for some dependents. I want you to really think about this rule in particular, because if you're going to move to an HSA, and that's your right under the statewide bargaining terms from 2019, you would have to enroll in the silver CDHP, as I'll talk about coming up. But I also want you to make sure that if you make that decision, that you are not subject to the prohibitions on contributions in the IRS rules, that you are eligible for those contributions for yourself, and also that any dependents that you have on your plan who are also can be covered. Their medically qualified expenses can also be covered with an HSA. Any money deposited in an HSA is pre-tax, it grows pre-tax, and it's withdrawn pre-tax for qualified expenses. If you take the money out for something that's not a medically qualified expense, and the IRS has a long list of what those are, you will be taxed by the IRS. There's a penalty for doing that. And again, the HSA dollars are used to pay the member share, your share of the cost of out-of-pockets. The account and the funds belong to you, the employee. So if you don't use the funds and you leave employment in your particular school district, whatever money you did not spend from the HSA for medically qualified expenses is your money to keep. There's no use it or lose it provision. With the health reimbursement arrangement, an HRA, it's eligible to be paired with any of the four VHI plans, but it's funded exclusively by the employer pre-tax. You, the employee, cannot contribute to an HRA the way you can with an HSA. And those contribution levels for the HSA, I don't know if I said this, those contributions for the HSA, they're also set in statute and regulation. But with the HRA, it's just the employer who contributes. What can you cover with an HRA? Same thing you can with an HSA, qualified medical expenses, subject to deductibles, co-payments, co-insurance, consistent with whatever the cost sharing arrangements are through a collective bargaining agreement or a statewide agreement in our case. If you don't use the funds in the employer's HRA, let's say you don't go to the doctor, or you don't go to the doctor a lot, and so whatever amount of money the employer budgeted for your medical experiences that year are not exhausted. In that case, the funds stay with the employer, they stay with the school district. And the school district then can roll those over, if they wish, in the next year to cover new healthcare expenses for the staff. And importantly, HRAs are not subject to IRS rules that prohibit contributions by employees or employers to HSAs. And they're not subject to the restrictions as HSA funds are for certain dependents. So there's a lot more flexibility with HRAs. So I'll give you an example. We have a lot of employees work in our school districts who have dependents, let's say between the ages of 23 and 26, who are on their parents' healthcare plan, but they're not tax dependents. They're eligible to be on your healthcare plan under the ACA, the Affordable Care Act, but they're not your tax dependent. Because they're not a tax dependent, you cannot use money in an HSA, a health savings account, to cover those dependents' qualified medical expenses. But you could use the employer's money in an HRA to cover those dependents' qualified medical expenses, even though they're not tax dependents. That's one of the critical differences. There are others. Medical Flexible Spending Account, shorthand FSA. A flexible spending account generally is funded by an employee through payroll deductions. You make an election to have an FSA at the beginning of a plan year. You tell your employer how much you want deducted pre-tax from your paycheck every 2 weeks. And the employer takes out that amount of money up to the maximum that you have asked to be deducted. And that maximum has to be consistent with what the IRS has said is the maximum. And then you can use that money to reimburse yourself for qualified medical expenses. That, again, defined by the IRS. Now, employers can make a contribution to an FSA, and there's rules and processes governing that. But in our world, generally, most school districts do not make a contribution to an FSA. That is done in most cases just by the employee. This is strictly a voluntary decision. You're not required to have an FSA, but a lot of our employees, our members do have them, and they find them really useful. Now, FSAs have a use it or lose it rule. So if you ask your employer to take out a few $100s for a particular calendar year to cover qualified medical expenses to reimburse yourself, for example, to reimburse your out-of-pocket obligation. If you don't use that money by a set period of time, you can lose it to the employer. The IRS permits the employer to keep that money. Now, there are also two major categories, two rules, if you will, to limit the negative impact of that lose it. And these are grace periods and rollover provisions that allow you to use more of the money for a longer period of time after the end of a calendar year. When I was first using an FSA back in the day, there were no grace periods and there wasn't a rollover. So if I didn't use that money by the end of a calendar year, I lost it. The grace period and the rollover allow some grace period and rollover benefit that allows you to get more effect, more advantage from the FSA. A medical FSA cannot be used with an HSA. This is important. You can have a medical FSA and an HRA combined, but you can't have a medical FSA and an HSA. The IRS doesn't permit it. But you can have a limited purpose FSA with an HSA. And a limited purpose FSA can be used for services such as dental, eyeglasses, and contacts. Okay, so that's a whirlwind tour of your VHI benefit plans. What I showed you when we were looking at the 4 plans and their deductibles, their co-insurance, their co-pays, their maximum out-of-pocket limits in a calendar year. All of those numbers are prior to applying the cost-sharing arrangements from the statewide bargaining agreement in December of 2019 that is in effect this year. Right. If you were just shopping on the market and you saw those 4 plans, those would be the costs that you would study if you were paying all of the cost of those plans. But those large costs that you saw are subject to the cost sharing arrangements with your employer. And I'll get to those momentarily. But first, I want to reiterate that in 2022, your VHI benefit plans are not changing. Same 4 plans, same medical benefits, same medical networks, same 4 tiers of coverage: single, 2-person, parent, child, or children, and family. And all 4 plans, once again, have the same identical benefits and the same medical networks, meaning the same doctors and hospitals. When we give you access to this PowerPoint, you can review the plans in more detail by clicking on the link that's highlighted here. So, which of your dependents can be covered by your VHI plan? Under the terms of the statewide agreement, your spouse, a civil union partner, or a domestic partner, they're all eligible for coverage under your VHI plans, as are your children up to age 26, whether they are subject to being a tax dependent or not. How do you know if you're eligible for health insurance coverage? Under the terms of the statewide agreement, if you work an average of at least 17.5 hours a week during the school year or calendar year, you are eligible to be enrolled in a VHI plan with a subsidy for premium and with contributions for out-of-pocket costs from your employer, your school district. Your employer is going to make full contributions to your out-of-pocket cost liability. And your premium amounts will be prorated based on your work time requirements of your local contract. And this applies even if you are in your contractual probationary period. But the eligibility threshold to have prorated contributions toward premium or to be eligible for full contributions toward out-of-pocket costs is 17 and a half hours. You're going to hear me say this more than once between now and the end of this presentation. The statewide bargaining decision on cost sharing. When we talk cost sharing here broadly, we're talking about premium cost sharing and out-of-pocket cost sharing. What the numbers will show is that being enrolled in the gold CDHP is your safest bet if you want the lowest possible medical financial exposure. And as I said a few moments ago, this is where the lion's share of union members and their families are currently enrolled. You can apply a health reimbursement arrangement. You can choose an HRA with any VHI plan, any 4 of them. And as you'll see, this generally makes the most sense financially. And you can also choose a medical flexible spending account with any VHI plan, provided that FSA is offered in your collective bargaining agreement or by school district policy. You cannot choose a medical FSA if you elect an HSA, but you can have an FSA with a health reimbursement arrangement, an HRA, and many of our members do. You'll notice, or you'll remember that I made reference to a number of prohibitions, restrictions on who can and cannot receive a contribution to a health savings account, an HSA. With an HRA, those restrictions do not apply. So your spouse or partner can be in Medicaid, TRICARE, Social Security, and you can access an employer's HRA funding for your out-of-pocket qualified expenses. Your adult children up to 26 can have their out-of-pocket costs reimbursed, even if they're not a tax dependent. With an HSA, you cannot have a contribution, your own or an employer's, credited to you if you are in Medicaid or Medicare, or if you're applying to Medicaid or Medicare, or if you're in TRICARE, which is a military healthcare program, or a healthcare program for military veterans. You cannot have access to contributions to an HSA if you're enrolled or applying for Social Security, and your adult children up to 26, they're not your tax dependents, cannot have their out-of-pocket costs reimbursed. There are other restrictions and complications with the HSA that I wasn't able to get on these screens, but I, again, want you to take good care and read through all of those through the resources we have available for you so that you understand what they are, so that if you're choosing to move toward an HSA, move out of an HRA toward an HSA, you know exactly what you're facing. If you choose an HSA for calendar year 2022, open enrollment comes around this fall and you elect to move to the Silver CDHP plan. Let's say you were in the Gold CDHP. Now you're moving to Silver. This is the only plan under the terms of the first statewide bargaining decision where you can have an HSA. The HSA applies only to the Silver CDHP plan. If you elect Gold CDHP, you cannot have an HSA. You can have an HRA and an FSA, but not an HSA. And again, I apologize for the redundancy, but I've seen some folks make this mistake and I want to make sure you don't make it. There are big exceptions to who can and cannot make a contribution or on whose behalf a contribution is made with an HSA. Covered the medical and limited purpose FSA, so we won't go over that again. Now, let's say you're in the Silver CDHP, or before this first statewide agreement decision was made, you were in a VHI plan from 2018 on, and you had an HSA, and you might have been enrolled in the Gold CDHP. Your employer and or you were contributing to the HSA. You would, Joe, move the screen forward? Thanks. Any money you may have had in a health savings account, an HSA from 2018 to 2021, remember, that is your money to keep if you decide in 2022 you're going to be moving to the Gold CDHP, let's say with an HRA. You can keep the money that accumulated from 2018 to 2021, but you cannot contribute to the HSA in 2022 if you're receiving HRA contributions from your employer. And you cannot double dip, so to speak. If your employer is contributing HRA money to help you pay qualified medical expenses, you can't use that HRA money from your employer for those expenses and at the same time reimburse yourself for the same expenses to your HSA account. It's one, but not the other. Okay, once again, based on our calculations, the Gold CDHP plan will provide the lowest medical financial exposure to teachers and ESP under the cost-sharing arrangements that exist now in the VHI plans and the cost-sharing terms of the first statewide agreement, and here's why. Let's start with licensed staff, and let's look at premium payments first. How are premium payments structured under the statewide bargaining terms? Your districts are going to pay 80% of the cost of premium, regardless of whatever tier you're in, single, two-person, parent, child, or children, and family. They'll pay 80% of the cost of the premium charges for those tiers of coverage for either the Gold CDHP or the Silver CDHP. If you decide you don't want to be in the Gold CDHP or Silver CDHP, you're going to go to Platinum and Gold non-CDHP. The district's going to take 80% of the Gold CDHP premium. They're going to credit 80% of what the Gold CDHP premium adds up to, and you can attribute that amount of money toward the premium and Gold non-CDHP premiums. You'll pay the difference between that 80% and the cost of the Platinum and Gold non-CDHP plans. So if you're in the Gold CDHP or Silver CDHP this year or in 2022, the employer is paying 80% of the premium, you're paying 20%. And once again, in the Platinum or Gold non-CDHPs, you're going to pay the difference between 80% of the cost of Gold CDHP and the cost of the same coverage, same tier of coverage in the Platinum and Gold non-CDHP plans. You will pay, for this reason, a much higher premium if you enroll in the Platinum or Gold non-CDHP plans. So please be aware of that when you make your decision. When we look at employer and employee premium payments for non-licensed ESP staff, this is what we find. Between January 1 and December 31st of this year, 2021, contributions by our ESP members were the same as they were in each school district on December 30th, 2020. For teachers and administrators, for licensed staff, when January 1, 2021 rolled around, their premium contribution was set at 20%. Some of them were already at 20%, some of them were below 20%. We've had a few cases where people were above 20. As of January 1, 2021, for teachers and administrators, that across the state, their premium contribution was set at 20%. For ESP, that premium contribution come January 1 of 2021 through all of December this year was exactly the same as it was on December 30th, 2020. It did not increase. Now on January 1 of 2022, support staff who are not already paying 20% of their premium are going to pay 2% more, but not more than 20%. So if you're paying 14% of your premium now in 2021 and you're an ESP member, your premium contribution on January 1 is going to rise to 16%. If you're paying 12%, it's going to go up to 14%, et cetera. When we look at the out-of-pocket costs for licensed staff, your school district, if you choose an HSA, if you choose an HRA with any VHI plan or an HSA with the Silver CDHP only, your school district will contribute $2,100 towards your out-of-pocket costs for single coverage and $4,200 for all dependency tiers, two-person, parent-child, family. And these are first dollar contributions, meaning that your employer's contributions by the HRA or the HSA with Silver must be allocated first. toward these medically qualified expenses before you are expected to pay your out-of-pocket costs. So again, for this reason, generally choosing a gold CDHP plan is going to make the most financial sense, because that $2,100 or $4,200 goes a lot farther toward that out-of-pocket maximum in the gold CDHP, which is $2,500 for single and $5,000 for family coverage. Whereas with the silver CDHP, the same amount contributed by your employer, $2,100 or $4,200, but it's toward a maximum out of pocket of $4,000 for single and $8,000 for dependency coverage. When we look at employer and employee out-of-pocket costs for non-licensed ESP staff, your employer is going to contribute $2,200 towards single out-of-pocket costs, single coverage out-of-pocket costs, or $4,400. So the employer's obligation for ESP staff is slightly greater than it is for teachers and administrators or licensed staff. And those contributions are funneled through an HRA, the employer's account, or by making payments into the HSA account for people who are enrolled only in the silver CDHP. And these two are first dollar contributions. So the employer's contributions are used first before you would be obligated to pay your out-of-pocket costs. Same conclusion here as in the previous slide. Choosing the gold CDHP for ESP is going to make the most financial sense for these reasons. Maximum financial exposure, or simply put, what's it going to cost me? So what is it and why should you care about it? Maximum financial exposure amounts to this. It is the sum of what you have to pay towards your premium plus your out-of-pocket cost exposure. Here's the definition written out for you. Premium share, your portion, right, and your out-of-pocket cost, your share, after the district's HRA or HSA funds have been spent. And this maximum financial exposure, premium plus out-of-pocket, is going to vary from year to year, depending on your medical experiences, depending on which plan you're in, and ultimately depending on the terms of cost sharing in the statewide bargaining process. So I'm not going to spend a lot of time in these next slides, but I wanted to highlight sort of empirically with numbers where the difference is in terms of maximum financial exposure. For licensed educators, if they are enrolled in the gold CDHP in FY22, their maximum financial exposure, premium plus out-of-pocket max, would amount to $2,311. And you can see how that compares for single coverage with the other three VHI options. The gold CDHP is still, financially speaking, the best bet in terms of keeping your financial liability lower. For two-person coverage, you see the same dynamic in place, significant difference between the gold CDHP and the other three plans. Parent-child, same logic at work, and no surprise, with family coverage, once again, the gold CDHP in terms of maximum financial exposure, your premium contribution, plus your out-of-pocket max, after the employer's contributions have been contributed, you're seeing a substantially lower maximum financial exposure than you would under the silver CDHP or the platinum and gold non-CDHPs. You can find more information about licensed educators and medical financial exposure, maximum financial exposure on the links here. VHI went to a lot of trouble last year to build this cost comparison chart for FY21 to help people see what their maximum financial exposure was in each plan, what their out-of-pocket maximum would be, what their premium contribution would be, depending on whether they were licensed or non-licensed. We have not yet had the opportunity to update those cost comparison charts, but they're still very useful. They can give you a real sense of how the numbers work. You can get access to them on these particular links. Unfortunately, I can't do for you for ESP what I just did for licensed. And that's because the ESP premium co-share is different across the state, as I explained. It's not one number as it is for teachers and administrators or licensed staff. So once again, although I can't generate those hard numbers for the ESP staff who are with us today, we can show you how VHI did it for FY21. What follows in the next slide are links that will explain those numbers and how we arrived at them. And soon enough, VHI will update all those numbers for you, and certainly well in advance of you having to make a enrollment decision for FY22. And here are just directions on how you can access that cost comparison chart and how you can sort of manipulate it and use it to your advantage. No surprise, your maximum financial exposure is ESP, just like for licensed staff. In the gold CDHP is substantially lower than the silver CDHP. And for ESP members or for their dependents who have chronic conditions, high pharmaceutical costs, if you're facing expensive medical procedures, if you're enrolling in the silver CDHP, that could be a very costly decision for you, even with an HSA contribution. And again, that's because the contribution to an HSA is identical on the employer's part as the contribution to an HRA. It'd be $2,200 or what is it, $4,600. But the silver CDHP maximum out of pocket is substantially higher. So that contribution by your employer doesn't go as far, which means you're exposed to potentially to a higher out-of-pocket risk. So again, that doesn't mean you can't enroll in silver CDHP or choose an HSA. You just have to be aware of what that out-of-pocket exposure is going to be for you, or what your maximum exposure is going to be if you include your premium. And once we update that chart on the VHI website, or Vermont-NEA provides that information through its website or other venues, you can compare apples to apples. And here's just a list of where you'll be able to find information about the plans, about the cost sharing arrangements, about statewide bargaining. And again, much of this information is going to need to be updated as well as we move into the fall and as open enrollment bears down on all of you. So again, my apologies for having to sort of move so quickly through this. I'm going to pause now and take any questions that you have.
Great. Thanks so much, Mark. So we're going to open it up to questions now, and I'm going to actually stop sharing the PowerPoint. And for the Q&A, if you would just please either use the raised hand function to indicate that you have a question, or alternatively, you can use the chat and I'll read out the question for everyone. And so just one more time as a reminder, we're going to be sharing out the recording of this presentation, putting it on the vthealthbargainingteam.org website, and also including Mark's presentation on that website as well. And I'm putting the link to that website in the chat one more time. So feel free to throw out your questions.
You know, if you don't mind me interjecting, I've got a question. What do you think is causing the greatest confusion or anxiety or both at the local level when it comes to these plans? Where do you think people are getting befuddled or just confused or worried in ways that make perfectly good sense? Any ideas about that?
Laura, I see that you're speaking, but I think you're muted.
Can you hear me now?
Yes, thanks.
Okay, thank you. I think in our district, over the past couple of years, to educate people between what the differences are between HSA and HRA,
Right.
and like the cafeteria plan, the FSA. Right. With the way that our healthcare is structured now, like what you said about there's the potential for people to lose money, because if you put $500 of your own money in there, but say you only use $250, And, you know, if your district doesn't have like that grace, you know, an extra grace period, you're going to lose 250 of your dollars. Whereas I think before these changes over the last 2 years to our healthcare, people were used to using an FSA and possibly putting more money in it and never losing any money. So I think that's been kind of difficult to explain to people where, and like the HRA, that's coming strictly from your employer.
Right.
You cannot lose money in an
Correct.
HRA. So I like when Cindy Dowman and I negotiate for support staff in our district is constantly trying to get us to swing people towards an HSA. And I think it's to their benefit, not necessarily to ours all the time.
No, that's well put. Again, I apologize for this redundancy, but I've seen some real difficult and sometimes painful situations when people enroll in an HSA, but they're not eligible for a contribution, or they enroll in the Silver CDHP because the contribution to the HSA, $2,200, let's say, for single coverage, it's a lot of money, right? And so there's a great temptation to take those funds, put in an HSA account, knowing that if you don't use it, you get to keep it. You can also use it for retiree healthcare expenses in the future, et cetera. So the rhetoric around the HSA, the marketing around the HSA often makes it feel like a very attractive option, a real financial boom. However, if your 25-year-old daughter is not a tax dependent and is on your healthcare plan and needs medical expenses, you're not going to be able to use those HSA funds to protect her from out-of-pocket costs. And if you're not aware of what that maximum financial exposure is on the Silver CDHP, you may learn too late that while that $2,200 is an attractive sum in and of its own self, it's still a far cry from the $4,000 maximum out-of-pocket liability in the Silver. So you could be looking at a pretty high bill or a series of bills until you hit that $4,000 maximum out-of-pocket. Right. And I've been really frustrated, I will confess, to knowing how to educate our members about those risks. And especially during COVID, when we can't get together, there is a need for more education, Laura. I agree on all of these issues. And I have been, and will be continuing to talk to my colleagues at VI about how we can be more effective in that regard.
And I'm not going to lie, it took me quite a few meetings. You know, when you did those informational meetings with Laura Soros years ago, before this all came about, it really took me, you know, a bit to like process all of it. And I think that's what, you know, is happening with our members too. I don't think it's something that just you all of a sudden you understand it overnight, because there's a lot of things I don't understand. Yeah.
It can be very arcane, very complicated, and unnecessarily so, in my opinion, but it's the reality we're facing.
Okay, thank you.
Thanks, Laura. Tessa.
To answer your question earlier, Mark, I think just there's too many letters and too many different accounts. Like I have to go to one place to look at one account and go somewhere else to look at one account. But I want a clarification. I have the gold one, the CDHP gold, and I have an HRA, which my employer contributes to, right?
Correct.
And I can have an FSA with that, but not an HSA?
That is correct.
Okay.
And
so I don't think in the past I've had an FSA, and that's what I've paid for like prescriptions with.
Right.
And this year I'm thinking I must not have set that up, because when I give them my Blue Cross Blue Shield debit card, they tell me it doesn't cover prescriptions.
What they may be doing is they may be covering all of those expenses still from the HRA. The HRA should pay first. Once that HRA is exhausted, if it is, then your FSA is there for backup.
Okay, so I think, and you have to set that up every year?
Correct. You have to elect it every year.
I maybe didn't do that this year.
You may have had some rollover though from the year prior, to Laura's point, if it's permitted by your school district. So you might want to check with your school district to see if there's any rollover there still.
But then the
But
plans keep changing and I keep getting new cards. So I
yeah,
lose track of like,
yeah, you would have gotten new plans. One of the things I didn't mention and perhaps should have is that all of your districts have contracts with third-party administrators. So there's VHI, there's Blue Cross that we contract with to pay your claims and provide other services. All those claims that are processed then move to your third-party administrator, which has to manage the payment system here for out-of-pocket costs consistent with the terms of the statewide agreement, keeping tabs on what the employer is obligated to pay and what you're obligated to pay if you reach that level, both for the HRA and for the FSA if you have one. So there is enormous complexity here and different entities sort of interacting with each other. So it's no surprise that people would be confused.
Thanks, Tessa, for that question. So, Mark, we have a question in the chat from Virginia. Her microphone's not working. She's an employee in the central office, and the most confusion she hears is that Blue Cross Blue Shield processes claims and does not pay anything, in quotations. There is so much confusion about how the HRA or HSA piggybacks the health plan and pays up to the designated dollar value for deductibles, copays, and coinsurance.
So here's how it should work. You've got an HRA, let's say you're in the gold CDHP. Your employer is going to contribute the amounts I spoke to earlier for single coverage or family coverage in its first dollar. So that's the first stream of payment. It's got to come out of the HRA, the employer's account. The claim is processed by Blue Cross Blue Shield of Vermont, and then it's sent to the TPA, the third-party administrator. That might be further, could be DataPath, maybe CS1, Healthy Dollars. Those are the most common in Vermont. I think Health Equity may still have some accounts in Vermont. So once the Blues approve the claim, once they process it, then it's going to the TPA in order to make sure that your maximum amount of dollar, your maximum out of pocket maximum, your out of pocket maximum, excuse me, is being tracked and your employer's money is going in the direction it should. And if you then have to pay, that you are held responsible for that liability. Once that maximum out of pocket is hit, let's say it's the gold CDHP, so it's $2,500 for single, $5,000 for dependency coverage of any kind. Once those amounts are hit by any combination of medical or pharmacy expenses, medical device expenses, etc., then VI pays 100% of your costs. So Blue Cross and the TPAs are tracking that as well. I mean, Blue Cross will know when you've hit that maximum out of pocket. And then VHI is on the hook for every other expense that you may incur for medical or RX. And we are informed, obviously, we keep tabs on what all those expenses are as the claims roll in over the course of a year.
So we're almost out of time, but there are two questions
Sure.
that I think are really important. The first one is from Mary. Mary retired in 2006, and her question is, will I have the plan I was in at the time that she retired, or one of these plans?
So Mary, are you a teacher? Okay. So as an educator, a retired educator, when you enroll in the Vermont State Teachers Retirement System Healthcare Plan and begin drawing a pension as well, those plans are different from the ones you have as an active employee. You're actually going back to the future, Mary. You're going back to the JY plan, the Vermont Health Partnership, and the 300 comp, the plans that were closed out on December 31st of 2017, just before the transition to the high deductible health plans that are in place today. So no, you'll not have the same plans. They'll be old and new, if you will, at the same time. And the Vermont State Teachers Retirement System can help you navigate all of that. And if you need any assistance, please feel free to call me.
Okay, thank you.
You're welcome.
Thanks, Mary. And then Tessa also had a question. Does the same third-party administrator handle HRA and FSA, or are they different?
In your school district, depending on who your TPA is, all of those accounts should be handled by the same TPA. I have not heard of any school districts with a separate FSA arrangement and something different for HRAs and HSAs. These TPAs are set up to handle all of those health spending accounts, and even if a few others that we didn't talk about today, because they're not relevant to our situation.
Well, we're out of time. Thank you so much. Actually,
So I think
Cindy
there's
had a
one more question from
Yep.
Cindy.
How long is the enrollment period usually for the FSA?
Ah, good question. I think most school districts have the same open enrollment period for FSA as they do for plan enrollment and HRA and HSA selection. So whenever your district's open enrollment period begins, that'll be the opportunity you will have, I presume, to make an election for an FSA if you choose to. Perhaps some school districts do it differently, but it's my understanding that the open enrollment period covers all those contingencies: plan enrollment, HRA, HSA, and FSA enrollment.
All right. Thank you all so much. Once again, we will post the recording of this session to the vthealthbargainingteam.org website, along with Mark's PowerPoint presentation, and we'll make sure everybody gets access to that. So thank you all so much for joining us, and have a great evening.
Take care, folks. Thank you.
Bye.
Call me if you need to.